Pleasure to see both of you again. I see you brought your little budding boy to it so
His name is Luke Michael Smith, named after John's father.
Well, that's a beautiful name. You can set him down right here.
The nurse says that he weighs 8.4 pounds when he weighed him right before you came in, but he weighed 7.9 pounds when he was born. Is that bad?
Baby Luke is doing just fine. He's above the 50th percentile in weight for a boy his age.
That means he's above average in weight, right?
Yes, it does mean that. Unfortunately, weight is not the be-all, end-all of a newborn's health, so if you do not mind, I would like to examine Luke further. Now, this may look bad, but it's imperative that I check Luke's eyes to make sure that there are no cataracts blocking them, because if there is cataracts or any illness that is correctable, it is best to correct it as soon as possible so as to avoid permanent blindness.
That makes sense. But isn't a baby's sight really bad at this age anyways?
That is actually correct. Luke will not be able to see in complete color for a couple more weeks now, and his depth perception does not set in until he is at least 6 to 7 months old. 20/20 vision won't be available to him until he's about 4 years old. But since growth happens every day, it is always imperative to correct the illness before it changes how the brain processes the information, because he may become permanently blind otherwise. Fortunately, he appears to have proper dilation of the pupils, and he seems to follow my finger quite well for a baby his age.
Speaking about proper development, it appears that Luke thinks it's appropriate to slam cupboards in the house. This causes Luke to flail. Sometimes it even seems like he's trying to grab onto me, like he's scared.
What you're talking about, Mrs. Smith, is the moral reflex, a completely normal reflex and desirable reflex for a baby to have at this age. I will assess it next. See, a reflex that all babies have at this age is to keep them safe. It's also very cute as well. But Mr. Smith, I do suggest not slamming cupboards when Luke is trying to sleep. A newborn needs 16 to 18 hours to sleep a day. They're growing at a very fast rate and need all the sleep they can get. Interruptions from outside stimuli do not help.
Oh, when will he stop being so boring?
John!
What? It's true. Oh, come on, Sally. I'm only joking.
Babies need sleep at this age, but you're right. He will be being boring for a couple months, but soon he will be more entertaining. Although his reflexes are very cute.
Oh, wow. My little boy, he's going to become a quarterback. Look at that grasp.
That's called the palmar grasp, a reflex that will dissipate soon and is meant to bond him to you.
Oh. Well, can you at least tell me how to comfort Luke? He's constantly wailing. Whenever I pick him up, it's like he hates me or something. He's almost acting like a little girl.
John!
Well, infants do tend to favor and bond more with the mother, since they already used to her heartbeat and are oftentimes near their mother more due to the nature of breastfeeding, a tendency that can dissipate with time, so long as you continue to interact with him. Now, as to the wailing, you can easily soothe him by talking softly to him in a light voice. Remember, babies are babies. They're not supposed to be strong men. He needs to be soothed and spoken warmly to. Touch is an excellent choice with a baby. They love the feeling of your hand on their back. It completes them. Maybe even rock him back and forth or give him a pacifier. All of these are viable options to make him feel secure.
So you stated that these reflex will leave. What's to come next?
He will be able to actually hold himself up, of course. Yeah, he'll practically be doing push-ups at this point. Give it 2 months. You will see.
Really?
Actually, John is right. Not as dramatic as doing full-fledged push-ups, but at about 2 months old, you should be able to put Luke on a nice soft blanket, and he should be able to lift his chest off the table and look up at you. Any other thoughts, John?
Well, I know Luke will be able to hold a rattle by 3 months of age, right? And make that cute cooing little sounds babies usually make.
Close, Sally, but it's actually 4 months. But yes, he will be able to do that, as well as roll over if you place him on his stomach, back to his back, and even reach for things.
Amazing. And then, what happens next?
Sorry to bother you, Nurse Jordan, but there is a family with a sick baby who would really like to see you since your area of expertise is better suited for it. I can finish up here if it's okay with the patients, of course.
Of course, it's fine.
Thank you for letting me know. Can you explain it to John and Sally what will happen at 6 months of age for a baby like Luke normally? They are very curious.
Well, at 6 months, Luke should be able to sit up unsupported and roll from his back to his stomach. He will even be able to make that raking grasp, you see, when a baby wants to bring something closer to them. But I do feel we are getting ahead of ourselves here. With babies, they grow awfully fast. You must enjoy every day that comes your way with them.
Unfortunately, my maternity leave won't be up for another 5 months. But I feel like I should get back to work within the next month. I'm just afraid of leaving Luke alone. Is it okay for a baby so young to be left with strangers?
Of course, it'll be fine. Just a daycare with some good qualities. I recommend planning some scheduled meetings with them as well as popping in for a random visit. That way, they can't only put their best foot forward, and you can make sure Luke will be safe. I suggest seeing how well they control the kids and understanding that Luke is such a young baby, the small caregiver to baby ratio should be about 3-to-1.
I don't want to part with my baby. He will miss me.
Oh, don't worry, Sally. You just have to find a daycare you feel most comfortable with. Some people even do in-home sitting. Also, if you do not feel comfortable leaving Luke alone with other people, it may be wise for you to take your full maternity leave, especially since you have so much time. Better safe than sorry, especially if it'll make you feel better. Do you understand? Good. Now, can you tell me what Nurse Jordan went over with you so I don't miss anything?
Of course. So basically, Luke has these 3 little reflexes, right? They will leave soon though. But for the time being, he flails when started. I'll show you. She went like this. Then his little arms went up. And oh my god, I couldn't believe it. And then she checked his eyes. She flashed them into his the flashlight, right? Flashed the flashlight into her eyes to check for dilation. Apparently cataracts was set in and that would cause, permanent blindness. But we want to make sure that he's not blind so he can play football, right? And then, well, that part won't leave soon, but still, pretty cool. He does this thing called the palmographs. Watch. Did you see that? He grabbed my hand. Did you see it?
That is pretty cool. He should also pretend to walk almost, like kicking his legs when you pick him up.
Yeah. I know that. I also know that apparently Luke has to be treated like a little girl for a couple months.
That's enough, John.
Sally?
When Luke wails, we will be sure to talk to him soothingly and rub his back. We may give him a pacifier, walk him back and forth to soothe him. Nurse Jordan also told us what we should expect in the coming months. But to basically focus on the present because he will grow a lot and change substantially. I do not know if I would like to take off from maternity early.
Sally, give me your hand, please. Wonderful, Sally. When Luke is ready, he'll be ready. We will take it one step at a time, like Luke here. We will figure it out. Do not worry. And we will come back to you if we need any more advice.
Well, I'm glad to hear that. I guess all that is left to say is, do either of you have any more questions regarding baby Luke?
I do. Just one.
And what is that?
When will we be able to play football?